Dr. Sujit Ranjan is the Executive Director of the Coalition for Food and Nutrition Security. He has been associated with the public health nutrition sector for more than 2 decades. His experience includes leading and managing large scale programs, policy advocacy, and partnership management. Before joining the coalition, he has worked as the director, Care International in India, and has been the chief operating officer of Swasthya Management and Research Institute, Hyderabad. He is also a Visionary Leadership Fellow in Population and Development by the International Council on Management of Population Programs, Malaysia.
Having been established in 2007 under the leadership of Professor M.S. Swaminathan, the coalition has now entered in its second decade as a platform for members to collaborate and achieve the vision of sustainable food and nutrition security for all. The mission is to raise awareness, foster collaboration, and advocate for improved programs. CFNS acts as a catalyst, offering evidence-based knowledge and thought leadership to inform, inspire, initiate actions, and collaboration that will contribute to the reduction in child malnutrition in the country. Although India has shown progress in improving child nutrition, the undernutrition burden in the country still remains very high. Wasting is commonly considered an acute condition when compared to other manifestations of malnutrition, as it can be relatively rapid in onset and resolution. Prevalence of stunting and underweight among children below 5 years in the country has seen a significant decline in the period of 2006 to 2018. That is based on NFHS 3 data and Comprehensive National Nutrition Survey Report 2018. However, wasting and severe wasting prevalence has shown very little change from 2006 to 2018. Similar trends are being observed in NFHS 5 data released for 22 states and UTs in the month of December last year. Multiple forms of malnutrition reduce the nation's economic growth owing to reduced schooling, compromised adult labor productivity, and increased healthcare costs. However, cost of wasting has been difficult to assess due to its transient nature, as it does not last long and children usually recover or die. Secondly, the condition overlaps with other diseases and therefore difficult to delineate. In this backdrop, an analysis was undertaken by CFNS to estimate the losses incurred due to childhood wasting in India in health and economic terms. The report is available in the public domain. The coalition, in coordination with government and civil society organizations, is providing a unique platform to drive a child-centric and community-focused narrative for community-based management and treatment of severe acute malnourished children in the country. The initiative is being carried out in the state of Jharkhand, Madhya Pradesh, Assam, and Odisha. The aim of this initiative is to speed up equitable progress and nutrition outcomes for every last child. A dossier on community-based care of children with acute malnutrition is also prepared and released by the coalition as the outcome of a collective efforts to bring evidences and learning from various successful community-based programs of care of children with acute malnutrition from different pockets of the country. The report is also available in the public domain. The Coalition for Food and Nutrition Security brought together a broad range of stakeholders working on nutrition in India through Commitment to Action, that is CTA, to join forces and ensure that a strong focus is maintained on nutrition during the unprecedented times as the country grapples with the short and long-term shocks of COVID-19 pandemic. CFNS, in collaboration with Sitara IIT Bombay, has also prepared a NutriGarden Compendium, which is the outcome of collective efforts to bring evidences and learning. Many people have taken part in this extensive journey in visible and less visible ways. The primary aim of NutriGarden Compendium is to generate an awareness and knowledge on various modalities of NutriGarden and the role of in improving food security, nutrition security, as well as food safety at various level, community level, household level, by highlighting the extensive work done by different organizations, different institutions across the country, and highlight individual case stories also. Zero hunger and good nutrition have the power to transform and empower the present and future generations. The Coalition for Food and Nutrition Security is the largest platform in the country and provides real opportunity to transform the food and nutrition landscape given its inherent strength as a multi-stakeholders alliances of policy and program leaders and implementation convergence for result-based programming. Together, we are very much confident we will make it possible and make it successful. Thank you very much.
The Vadu Rural Health Program was established in 1973 in a village which is called Vadu, which is about 30 minutes from KM Hospital, which is situated in Pune city. Now the main objective of forming this rural health program was a response to an outbreak of diarrhea in that period. So doctors from KM Hospital Pune went to this place, set up this center and tried to fight this diarrhea episode outbreak that occurred in 1973. And since then, doctors continue to work there. Doctors from KM Hospital Pune continue to work there. And since then, over the last 50 or 60 years, the Vadu Rural Health Program has evolved into a large rural community health program which focuses on research, primarily health research, as well as providing services to rural communities in and around Pune. I'll just give you a brief portfolio, about the kind of research work that Vadu Rural Health Program does in this area. We focus mainly on maternal and child health, or health of mothers and children, newborn children, young children, infant children, and little older children also. Along with that, we also conduct a lot of work in non-communicable diseases. What I mean by non-communicable diseases is heart diseases, hypertension, or high blood pressure, diabetes, stroke, etc. So we try to work with communities in these disease and illnesses and try to find out solutions. So we try to test solutions to improve the health of these people, communities, and then once they are successful, we help them to roll out on a larger scale also. Now, I'll give it just to illustrate my point. I'll give you a couple of examples of how we do this. We recently conducted a research study and actually implemented it successfully in partnership with the local government health system on saving lives of newborn babies who are infected. So we implemented a protocol for the diagnosis and treatment of newborn babies in tribal areas in Pune district. We ran that project for 2 years and we successfully showed that newborn babies' lives can be saved by implementing this protocol of management and treatment, specific protocol. Now, this protocol is being adopted by the government of Maharashtra and the government of India so that they can roll out this protocol for saving newborn lives on a much larger area. Another example that I would like to give is the Rotavac vaccine. So rotavirus is a virus which used to cause diarrhea in large numbers in young children, small babies and young children. A few years back, around say 4 years back, a new vaccine was made to prevent this virus from attacking children. but the vaccine also needs to be tested. So KM Hospital Research Center Pune and Vadu Rural Health Program tested the vaccine and then helped the government to roll it out on a pilot basis in 4 talukas in Pune district, all in rural areas, no urban areas. We showed that this vaccine can easily be rolled out in rural areas through the public health system, and the number of diarrhea cases can really be reduced or in this children group, and the health of children, young children and babies can be improved. Today, this Rotavac vaccine has been accepted by the government, and it is part of the routine immunization system in the public health system all over India. Another example that I'd like to give of how we have tried to improve lives of rural communities is by reducing the household pollution due to use of biomass chulhas, right? So we implemented a project in which we provided LPG cylinders and gases to women, to households in tribal areas which had never ever used gases. They were always using biomass chulhas, and due to which they used to suffer a lot of health problems because of the smoke generated by biomass chulhas, right? So we implemented a project in which we provided them LPG. We demonstrated that use of LPG in tribal areas is safe, it is readily acceptable, and households in those areas would like to cook food on LPG gases and convert or shift from the traditional chulhas to LPGs with measurable success in reducing the pollution related to smoke. Now today, again, we send these results to the government of Maharashtra as well as government of India. And today the government of India is now looking at ways to encourage greater use of LPG use in place of chulhas, especially in poor communities, rural communities, tribal communities, where the traditional use of chulha is very, very common, right? There are actually a lot more stories and lot more projects that Vadu Rural Health Program has been a part of success, has been successfully part of it, which have directly impacted lives of rural communities. But I mean, for want of time, obviously, I will not talk about them, but I will surely like to refer you to our website, Vadu Rural Health Program website. If you can just Google, you will get the website, and we have a long list of more than 100 studies, research studies and projects that we have undertaken over the last 20 and 30 years. Now, how do we do this? That's one obvious question that I think comes to everyone's mind. How do we do this? I mean, of course, there are scientific methods, research methods, medical methods of conducting research, but research will never be successful if we do not involve the people involved in these research, right? So, and hence, engagement of stakeholders in our research in our research projects is a very critical component. Now, what I mean by stakeholders are everyone who's part of the research and or impacted by our research. So obviously, what this means is our most important stakeholder is the community themselves. So people with whom we conduct research, people who will benefit from the results of the research, they are part of the whole research process. In fact, even when we are thinking about what is the problem and what are the research methods that we can show, and how do we show success or benefit of the project, we involve them in the discussions. We take their opinion. We take community leaders' opinion, community individuals' opinion about what should the ideal benefits be, what should the outcomes be, what the research questions should be. And then we conduct the research, then we design the process. And then once we finish up the research, we again go back to them and tell them, all right, look, this is what the result of the research project is. Now, how would you like to use it in the best way possible, right? So stakeholders such as community are a very important part of our research process. Another important research stakeholder is the public health system or the government health system. Because as we know, if we want to roll out any intervention, any treatment on a large scale, the government health system has to be involved. Of course, the private health system also plays a part, but in rural areas, government and tribal areas, government health system plays a greater part. So again, we always work with the government in conducting a research and designing a research, And once the benefits come in, we work with them to ensure that the public health system is able to roll out the research or scale up the benefits, the interventions to larger population. So the community and the government health system are two, I would say, very important stakeholders in our research projects that we conduct at Vadu Rural. Of course, there are other stakeholders also, such as other scientists, other collaborating institutions, other partners, both national as well as international. Today, we are proud to say that with an overall staff of around 180 to 200 at Vadu, almost 50% are women. And of these women, almost 25 to 30% are local women from the villages that we work in, who have been trained and who now go house to house, go around the villages, talk to other people, get data, provide interventions. So this is something, now this is not just, I'm not just saying to kind of showcase our work, but I'm also saying this because unless women are involved, and especially local stakeholders and women are involved, I don't think any health work, be it research, be it program, could be really successful. And we really credit the women who work with us, local women, local villagers, women who work with us, we credit them to a large extent for the success of all our studies, all our research that we have. So at the end, I'd just like to say that the overall motto of Vadu, the overarching aim of Vadu has been and will continue to be to work to improve the health of rural communities. And when I say health, as I said, we can work in any health condition that is the need of the hour. And we will continue to work with rural communities. We will continue to involve them in our rural communities, and of course ensure that women, men, everyone gets an equal opportunity to work with Vadu currently as well as in the future.